I hope you are doing well and welcome to our today's talk. Now, in our today's talk, we want to have a look at what we call the female infertility. Now, by definition, female infertility refers to the inability of a woman to conceive or to give birth to children after having at least a period of 1 year of unprotected sexual intercourse. It's also important to note that there are two types of female infertility. The first type is called the primary type. The second type is called the secondary type of infertility. Now, let's have a look at each one by one. Now, what is the primary type of infertility? The primary type of infertility in this case is the inability of a woman to conceive or have children at least after having a 1 year period of sexual intercourse which is unprotected, what we call the unprotected sexual intercourse. Now, the secondary type of infertility is where at least a woman has been able to at least have one child, but now unable to do so. Now, there are several causes of female infertility, and we shall have an ample time to look at each and every cause of the female infertility. Of course, the causes can fall in either primary or secondary types. Now, which are the causes? Number one is what we call the autoimmune diseases. So there are several autoimmune diseases that can also lead to female infertility. Now, which ones are they? The first autoimmune disease that can cause female infertility is what we call the SLE. SLE is also referred to as the systemic lupus erythematosus. The second autoimmune disease that can result into female infertility is called antiphospholipid syndrome, which is commonly referred to as APS. The next autoimmune disease that can lead to female infertility is what we call the thyroid autoimmune disease or diseases, commonly referred to as Hashimoto's disease. Now, the other cause of infertility falling under autoimmune diseases is what we call the diabetes type 1. As you remember, in diabetes type 1, we say that it's an autoimmune disease that destroys the pancreatic cells or the cells of the pancreas. In return, it can also destroy those cells of the reproductive system that participate in fertility. Now, our second cause of female infertility is what we call the birth defects of the reproductive system. So one can be born with a birth defect, maybe of the uterus, and we call these congenital diseases. One may not have any control over birth defect diseases. The third cause of female infertility is what we call the cancer or tumors of the reproductive system, female reproductive system in this case. And they include the cervical cancer, number 2, the uterine cancer. We can also have cancer of the fallopian tube, cancer of the ovaries. Those are some of the major or most common cancer of the female reproductive system that can result into female infertility. The next cause of the female infertility are various blood disorders, and in this case, the most common one, which is called the thrombophilia, which is the ability of blood to clot or form clots very easily. And this has been attributed to conditions or situations such as abortions or miscarriages. Now, our next cause of female infertility is what we call heavy drinking of alcohol. Now, as you can see, in almost all the conditions that we've discussed so far, alcohol plays a very key role. And therefore, it's an advice to all the female gender that kindly, if possible, refrain yourselves from alcohol intake. The next cause of female infertility is what we call too much of exercise. We have said several times that exercise is very healthy for the body. But at the same time, we've also said that too much of something is dangerous. And in this case, too much of exercise can then result into female infertility. The next cause of female infertility is what we call certain uterine growths or growths of the uterus. For example, we have what we call the uterine fibroids. Those are growths that can be found within the uterus. We can also have growths within the cervix, what we call the cervical polyps. We can even also have the uterine polyps. Those are certain conditions or growths that can inhibit fertility. Now, the next cause of infertility in women is what we call the pelvic inflammatory diseases. So these are more of infections within the pelvic region, all the organs within the pelvic region, particularly in this case, the reproductive system organs. For example, one may have cervicitis. Number two, one can have endometritis, that is infection of the uterus. One can have what we call infection or inflammation of the fallopian tube, which is also called salpingitis. One can even have infections or inflammation of the ovaries. Now, the next cause of infertility in women or in female is also called sexually transmitted diseases. And there are several types or several examples of sexually transmitted diseases, which is commonly referred to as STI. And examples in this case include things like gonorrhea, syphilis, herpes simplex, or even HIV infection. Now, the next cause of female infertility is smoking. So again, smoking is also very dangerous in this case, just as it is also dangerous in other conditions that we've looked at. Substances contained in smoke may interfere with the processes of fertility, and therefore any female must refrain from smoking, whether it is cigarette smoking or bang smoking. The next cause of female infertility is what we call reversal tubal ligation. Now, tubal ligation is more of a surgical family planning method which is done to the females. Now, if one attempts to reverse that procedure, then that particular woman is predisposed to infertility. Now, the next cause of female infertility is psychological contributions. There are various psychological conditions that can cause infertility, and they include things like depression, things like stress, and when one's mental state is disturbed, then the processes, the physiological processes, or the normal functions of the reproductive system, including ovulation, will be compromised, leading to infertility. The next cause of infertility in females are certain medications. So there are several groups of drugs, medicinal drugs, that can contribute to female infertility. And they include things like steroids. So the use of steroids, particularly the anabolic steroids, in this case, things like prednisone or prednisolone, if you may like, can cause female infertility. Groups of drugs like antidepressants, there are several antidepressants that can cause infertility. They include things like amitriptyline, methyl-dopa, and even carbamazepine. Certain anti-epileptic drugs, of course, even carbamazepine falls again in this class. We also have things like phenytoin can lead to infertility. We have things like family planning methods, certain family planning methods, In this case, the Depo-Provera has been linked to secondary type of infertility. Now, ladies and gentlemen, if in any case your sister, your mother, or any other female, whether your neighbor, has been battling all this that we are talking about, kindly make a quick referral to your nearby health facility so that she can be attended to by a gynecologist who can then take her through all this journey so that one day, one time, she can laugh and enjoy again. If you are watching us for the very first time, kindly subscribe, and until next time, it's goodbye from all of us.